It was close, but the House Republicans plan to undo pieces of Obamacare passed, scoring high praise from President Donald Trump. The president also says he's confident the bill will clear the Senate, where Republicans hold a very slim majority.
Yeah, we could try to tell you everything in this bill, from Medicaid to essential health benefits to tax credits, but we cannot do that in the next 30 minutes. So we're going to hit the most controversial issue, pre-existing conditions, and how this bill deals with those. Here's Chris Repsky.
It's an interesting concept and an interesting argument. How do you afford health care for people who need a lot of it? Right? That's like the ultimate question.
It's the ultimate question.
We spoke with Jean Abraham, a health economist at the U of M, to talk about pre-existing conditions. Those who likely need more care because of a chronic condition or illness and thus cost more money to treat. Here's an example of how someone who has, say, chronic back pain is covered now under the Affordable Care Act, and how that same person would be covered in the new American Health Care Act.
Chronic back pain is a good example. Currently, under the Affordable Care Act as we see it right now, someone with chronic back pain is covered how?
So someone who is buying individual coverage who has chronic back pain would simply apply. No information about their health history would be gathered when they're buying insurance, and that information would never factor into the premium that they pay.
And then again, under the AHCA, how would that change?
Yeah, under the AHCA, they would likely be okay so long as they did not have a break in coverage that would move them into underwriting.
And here's what she means. For the individual market, the American Health Care Act would give states the option to break apart the healthy and the chronically ill into two groups. This, in theory, would bring down costs for the healthy group, but bring up the cost for those in the high-risk pool. That state would only be allowed to do this if it could prove that costs would go down by having a pile of money set aside to help subsidize the costs of these high-risk pools. This is not a new concept.
Before the ACA, 35 states in this country had high-risk pools. Those pools were generally underfunded, they were capped. Individuals who bought coverage in them, they had to pay a lot out of pocket.
And that continues to be the concern of several analysts. The bill sets aside $138 billion to help cover high-risk pools in states over 10 years. According to the nonpartisan conservative healthcare think tank Kaiser Family Foundation, states would need more like $250 billion to cover the costs.
The challenge, of course, is that if you're going to do that type of segmentation, there better be a good plan and enough funding in place to take care of the folks who have serious medical conditions.
A little confusing there. I hope everybody got through that. But let's just say Minnesota did say we want a waiver, right? Yeah. And we want to make a high-risk pool for people with pre-existing conditions. They got a bundle of money there to help people pay for the higher premiums, right?
Right.
Here are the essentials. One, you'd have to be in that high-risk pool. You would have to have pre-existing conditions, right? You would also have to have a lapse in coverage for at least 63 days. So if you have the same plan and you don't ever drop it, even through work, you're not going to get dropped by anybody. You're not going to get charged anymore.
Okay.
It's the same. You have to have a lapse in coverage to be in that high-risk pool. And then after you're in the high-risk pool, it's only for 1 year. And then your premiums go back down until you lapse again.
Something that's important here that Rena and I were just talking about, just so you're all fully confused, is the Senate has just said, we're going to write our own bill. It doesn't really matter what's in this bill.
Essentially, everything I just reported on could be void tomorrow.
Hey, thanks, Chris.
You know what? But it's happening, and it affects everybody.
It does affect everybody.
Most important part of the Senate, though, is that what you said, they're going to wait for the Congressional Budget Office to review what's in the bill, the House bill, so that we know what's in it, and we know how much it's going to cost. So they're going to do their diligence. Senator Lindsey Graham, he had the best quote of the day. He said, we don't even know if it's a boy or a girl.
Because Lindsey Graham always makes sense.
Yes.
Interesting.
Just like you.
Thank
Thanks.
you, Chris.
Yep.
My. All right. The Boston Red Sox